Hello folks, in this video we are going to talk about the assessment of patients with retinal dystrophy. At the end of this video you should know how to perform history, clinical exam and management in general terms of any patient with retinal dystrophy. Let's start with the history. The history is key in patients with retinal dystrophy. First, you take a look at the age of the patient. Why is this so important? Because if patients are older and the disease is mild, the risk of blindness, for example, is much lower. You want to check the date or the year of the onset of the symptoms and the progression of the symptoms. Those are two very important aspects. You want to ask the patient if the vision is worse in the evening or during the day. Next, it's key to ask about marriage among family members, which increase the odds of autosomal recessive diseases. You want to ask if there is history of retinal diseases, retinal dystrophy, or even blindness in family members. Finally, during history, you want to ask about symptoms of other systems like hearing loss, kidney symptoms, or heart symptoms. After the history, you want to go to the eye exam. It is very important to do a very complete eye exam. You want to check visual acuity, anterior segment, you want to look for lens opacification or any other findings like anterior segment inflammation, intraocular pressure, and then you go to the diagnostic testing. You want to have a periodic visual field to check for progression. It is useful to do fundoscopy and fundus color image. Fluorescein angiography, OCT. On OCT you want to check for cystoid macular edema and the integrity of the neuroretinal cells. Both multifocal and full field ERG are very important and useful in the diagnosis and follow-up of patients with retinal dystrophy. After a good history and an eye exam, you should be able to have a differential diagnosis or a main diagnosis or a final diagnosis of patients with retinal dystrophy and recognize secondary conditions like cataract or cystoid macular edema. The three goals of the management are: number one, establish the correct diagnosis; number two, provide the genetic nature of the disease and family members and the patient, and provide general recommendations to improve quality of life and inform patients about clinical trials. So you also want to refer patients to other specialists, for example, ENT specialists. You want to treat the patient of their ocular complications like cataract surgery, cystoid macular edema with intravitreal injection of corticosteroids. You want to refer patients for visual rehabilitation. In my practice, I recommend patients to have a healthy life, eat well, sleep well, do exercise, and stay healthy to reduce stress, because the disease has a multifactorial component with a lot of photooxidative stress. It is also very important to inform patients about the prognosis of their disease once you have a diagnosis. Finally, I routinely get blood samples or nasal smear and send fluid for genetic testing. The geneticist in the lab will find one or more genes that are likely the cause of the retinal dystrophy. Once you have the more likely gene that's causing the retinal dystrophy, you want to research on clinicaltrials.gov, Google Scholar, Google PubMed, and find which studies are ongoing of clinical trials for the disease and also the natural history of that retinal dystrophy with that gene will provide valuable information for the patient and their family about the progression of their disease. In summary, I present to you in these 5 minutes very important and useful data for the assessment of patients with retinal dystrophy. I hope you enjoyed this video. See you next time.